How is refractory celiac disease seen in a biopsy? Have you ever wondered how doctors diagnose refractory celiac disease through a biopsy? This process is essential for understanding ongoing intestinal damage, even when someone follows a strict gluten-free diet. Let's break down what happens during this important examination. When a biopsy is performed, doctors look for specific signs that indicate refractory celiac disease. One of the first findings is marked villous atrophy. This means the small finger-like projections in the intestine, called villi, are blunted or flattened. This damage is often more severe than what is seen in typical celiac disease. Next, the biopsy shows an increase in intraepithelial lymphocytes, which are immune cells found in the lining of the intestine. In refractory celiac disease, there can be more than 25 of these cells per 100 epithelial cells. In type 2 refractory celiac disease, these lymphocytes appear abnormal, which is a key detail for diagnosis. Another important feature is crypt hyperplasia. This occurs when the grooves between the villi, known as crypts, become elongated. This change reflects ongoing damage and attempts by the body to regenerate the tissue. Additionally, the biopsy may reveal mononuclear cell infiltration in the lamina propria, which is the layer beneath the epithelium. This indicates an increased presence of immune cells, signaling that the body is still reacting to something, despite avoiding gluten. Epithelial abnormalities can also be observed. These structural changes in the cells lining the intestine can provide further clues about the ongoing condition. It is essential to distinguish between the two types of refractory celiac disease. Type 1 shows villous atrophy with increased but normal intraepithelial lymphocytes. These cells express typical markers. In contrast, type 2 is marked by more severe villous atrophy and the presence of abnormal intraepithelial lymphocytes. These atypical cells lack normal surface markers but retain others. Their presence raises concerns about a higher risk for developing enteropathy-associated T-cell lymphoma, a rare type of intestinal cancer. Understanding these biopsy results is vital for managing gluten-free living. If the biopsy indicates refractory celiac disease, it means that simply avoiding gluten is not enough for healing the intestine. Further medical evaluation and treatment become necessary. In summary, a biopsy for refractory celiac disease reveals persistent villous atrophy, crypt hyperplasia, increased and often abnormal intraepithelial lymphocytes, and epithelial changes. Recognizing these features helps healthcare providers offer the best care for individuals who continue to experience intestinal damage despite adhering to a gluten-free diet.